Our presentation on the onset of periodontal disease in early adulthood and the link between that and the oral microbiome. So periodontal disease affects nearly half of all adults over 30 and 70% of adults over 65. It causes gum recession, bone loss, and then eventually tooth loss. And it's caused primarily by poor oral hygiene, but it can be exacerbated by a family history, diet, smoking habits, and diabetes. In my case, I was diagnosed with periodontal disease in summer of 2023, and in my case, they believe that it's very largely exacerbated by my family history because my dad had it as well, and by just a naturally thin gum tissue in me. So I'm going to be looking at the link between the oral microbiome and the onset of periodontal disease, and whether there are any specific strains of bacteria that can incite periodontal disease to occur more rapidly in certain people or at a more earlier age, and whether any of these links are going to open up the possibility for preventative treatments that target these strains and maybe slow the disease. I spoke to my dental hygienist about this topic, and she said that it's actually a very active current area of research, and most of my sources are actually within the past 2 years. So it's a very active, very ever-changing field of research, and we're going to be diving into some of the conclusions for some sources. So this study looked at patients with gingivitis, which is early-stage periodontal disease, and it used a shotgun metagenomic analysis of the oral microbiome in their saliva, and it's going to show us the largest taxa of bacteria that are present in people with gingivitis. It divided people into two groups, H/LG, which means healthy/localized gingivitis, and GG/IP, which means generalized gingivitis / initial periodontitis. So the GG/IP group has a more advanced stage of periodontal disease. So the figure right here is going to show in figure B the relative abundances of different bacterial taxa at the phylum level and C at the genus level in the two different groups. And as we can see, there's a significant difference here, namely that the people with more advanced gingivitis have higher degrees of Neisseria bacteria, whereas the ones with the localized gingivitis have higher degrees of Fusobacterium. This figure right here is going to show the different oral microbiota among the two groups, and A shows at the genus level and B shows at the species level. So you can see that the generalized gingivitis / initial periodontitis, they have much higher degrees of Actinomyces species HMT897, Actinomyces species 897, and a whole host of other species. And this visual right here is also going to show the taxonomic abundance of different bacterial genera in the two groups. Figure B is going to show the significant bacterial species, the abundance of them, and then C is a histogram showing the distribution of species abundance of the oral microbiota in the two groups. And as you can see, the people with the generalized / the more advanced gingivitis, they have a whole host of bacteria that are higher in frequency, all those blue bars in figure C, whereas the people with the localized gingivitis have a higher degree of abundance of Neisseria bacteria, which was also present in this visual right here. So this study is going to examine the effects of probiotic supplements on the prevention and treatment of periodontal diseases. And this is just a visual showing the pathogenesis of periodontal diseases. So initially you start with no clinical symptoms, then there's oral microbiome dysbiosis, which is where there's a loss or a gain in certain microbial communities that wouldn't be present in a healthy person's mouth. And then gingivitis, mild periodontitis, severe, and then finally probiotic supplementation were used in addition to periodontal disease therapy. And that's what the study is going to be looking at. So the figures here, we're comparing the effects of probiotic supplementation on control groups. 4 goes on the basis of probing pocket depth, and the pockets are the differences between the gum line and the bone. 5 looks at clinical attachment levels, 6 looks at bleeding on probing, and 7 looks at gingival fluid. And as you can see, 6 is the only one where it really favors the probiotics. That's just the bleeding on probing test. So it doesn't seem like probiotics are very much favored in the treatment of periodontal diseases. This study just looked at defining what specific strains are associated with Porphyromonas gingivalis, which is a strain of bacteria present in people with periodontitis. And the main conclusion in this study was just that the W83, W50 strain was significantly enriched in people with periodontitis, which was only 13% of the participants. And it's not really enriched in people without it. This study just supported the study 2 studies ago, where it just said that maintaining a healthy oral microbiome ecology is very important in treating and slowing the progression of periodontal disease. And it supported the use of probiotics in these cases. And finally, this study shows a radiograph of a young patient, a 6-year-old girl with grade C periodontitis, specifically molar and scissor pattern periodontitis, which is seen on the radiograph on the left. And this visual right here is going to show the microbiome beta diversity in healthy sites and diseased sites. And essentially, the people on this, the scientists of the study concluded the fact that in kids with primary dentition, so baby teeth, they had a much more distinct profile, like a dysbiotic microbiome, which means that it's much more unbalanced. Like it's more abnormal compared to people with a permanent dentition, so people with adult teeth. However, a specific type of bacteria, Agrigobacter actinomyces called AA, was much more enriched in both primary and permanent disease sites, which means that this microorganism is very much implicated in this specific form of periodontitis in both adults and children.